And now it gives me great pleasure to invite someone I've worked very closely with, my co-star of many films, a person whose choice of quirky and unusual characters is very similar to mine, and whose passion for advocacy I share. Bhumi Pednekar.
Hello. Hi. Hello, hi.
Bhumi, among many things we've done together, I'm glad you're on the show. And मैं यूनिसेफ इंडिया का एक हिस्सा हूँ, मैं नेशनल एम्बेसडर हूँ उसका. एंड एक सोशल रिस्पॉन्सिबिलिटी होती है एक आर्टिस्ट की, कि अगर आप कुछ समाज से ले रहे हैं, अपनी फिल्मों के जरिए कुछ कह रहे हैं, तो आप ग्रास रूट लेवल पर जाकर उनके लिए कुछ किया जाए, तो उससे बेहतर इंसान, उससे बेहतर आर्टिस्ट हो नहीं सकता. तो आप अपने इनिशिएटिव के बारे में बताइए.
तो आई थिंक शुरुआत मेरी एक्टर बनने के पहले से ही हो गई थी, जहाँ पे मुझे लगा कि किसी ना किसी तरह से इट्स इम्पॉर्टेंट टू गिव बैक, यू नो, एग्जैक्टली जैसी आपकी सोच है. एंड छोटे छोटे चीज़ें करते थे हम, लाइक लिटरली जब कोई नेचुरल कैलामिटी होती थी, अ स्मॉल थिंग लाइक जस्ट गोइंग अराउंड द एरिया कि आप चंदा जाके इकट्ठा कर लो, तो वहाँ से ही आप में एक स्पिरिट आती है टू गिव बैक, टू डू समथिंग फॉर द कम्युनिटी. वो करते करते एक्टर बन गई, और फिर रियलाइज़ हुआ दैट देयर इज़ अ लार्ज ऑडियंस जो मेरी बातें सुनना चाहती है. और मैं फिल्मों के थ्रू भी मुझे रियलाइज़ हुआ कि सिनेमा एक इतना इम्पॉर्टेंट मीडियम है जिसके थ्रू हम एक बदलाव ला सकते हैं. टॉयलेट एक प्रेम कथा मेरी एक फ़िल्म थी जो बहुत ही ज़्यादा सेलिब्रेटेड थी. स्वच्छता अभियान का हिस्सा भी वो फिल्म बनी इन अ वेरी वेरी बिग वे, बहुत ज़्यादा इम्पैक्ट लाया. उस फिल्म से भी मैंने सीखा कि एक मास लेवल पे अगर आप बदलाव लाना चाहते हैं तो सिनेमा एक बहुत ही ज़्यादा इम्पॉर्टेंट टूल है. तो अपने फिल्मों के थ्रू कोशिश यही करती हूँ कि कहीं ना कहीं कोई थोड़ा पॉजिटिव चेंज आए, माइंडसेट में पॉजिटिव चेंज आए, और ऑफ स्क्रीन भी क्लाइमेट वॉरियर हो या UNDP ने जो मुझे जिम्मेदारी दी है टू बी द नेशनल एडवोकेट फॉर द SDGs, कोशिश यही करती हूँ कि जितना हो सके एक पॉजिटिव चेंज इन द सोसाइटी में लाने की कोशिश करूँ और एक बड़े बदलाव का हिस्सा बनूँ.
That's great. India is a very young country. हमारी जो अंडर 30 है एज जो है, 50% हमारी जो आबादी है, पॉपुलेशन है, वो अंडर 30 है. एंड मैं ये बोलना चाहता हूँ यूनिसेफ इंडिया के थ्रू मुझे बहुत कुछ करने का मौका मिला है. एंड मैं ये बताना चाहता हूँ कि हमने 3 हिट फिल्मों का हिस्सा साथ में रहे हैं. भूमि एंड आई पार्ट ऑफ दमनगा कैशा, जो इनकी पहली फिल्म थी. उसके बाद शुभ मंगल सावधान.
आई थिंक आयुष्मान इज माय लकी चार्म.
शी इज माय लकी चार्म. शुभ मंगल, ज़्यादा सावधान, तीनों फिल्में बहुत चली हैं. अब मैं क्वेश्चन ये पूछना चाहता हूँ कि यूनिसेफ और आपका जो इनिशिएटिव है वो साथ में कोलैबोरेट कब करेगा, वो हिट कैसे होगा हमारी फिल्मों की तरह?
तो मुझे लगता है आज आपने स्टेज पे इतने लार्ज ऑडियंस के सामने बोल दिया है. सर रियली होप कि जो UN की टीम है और यूनिसेफ की टीम है, UNDP और यूनिसेफ की टीम, वो सुन रहे हो एंड हम साथ में कुछ बहुत बड़ा करें. बिकॉज आई थिंक जब आप और मैं मिलते हैं, हमारे फोर्सेस कोलाइड होते हैं, तो सिर्फ अच्छी चीज़ें ही होती हैं उनके साथ.
And especially when the mission is the same, when the goal is the same.
Absolutely.
बच्चों के साथ, you're working for the climate. At the end of the day, future generations के लिए.
Absolutely.
Bhumi, a new movie is coming. Thank you for coming.
Yes.
And it talks about, it's very vocal about what women really want. Very often as women, we don't prioritize ourselves.
Yes.
So tell us about it. Tell us about the movie. What is it all about?
Well, as you rightly said, the film is against patriarchy. The film is against liberation. The film is about liberation. It is about equality. It's a comedy. The narrative is extremely funny. The character I play, she is a mess, and often we don't see women portrayed with with all their imperfections on screen. For me, I feel showing an imperfection is the most perfect way of portraying a character, and that's exactly what Kanika Kapoor is. Doing this film was a massive therapy session for me, because there were so many of my unresolved issues just as a young woman living in the times that I live in that the film addresses, and I'd never felt that kind of representation. I've been very fortunate to have played some very, very empowered characters, but they have been a little away from the life that I've lived. I feel like this girl is very close to the life that I have lived, because, she's a city modern girl, and even though, she has a lot of privileges, the film also addresses that, but at the same time, on every level, she faces sexism. There's just societal conditioning of women just being told that you're not good. You need to be apologetic about everything that you do. हम परेशान हो जाते हैं sorry बोल के. We kind of lose who we are, because there's so much of our happiness and confidence that is that responsibility is given to somebody else. And all the responsibilities that are given to us are not chosen responsibilities. They are responsibilities that जो हम पे थोपी गई हैं. तो फिल्म इन्हीं चीज़ों के बारे में बात करती है. सबसे मज़ेदार बात है कि एक कॉमेडी फिल्म है और इट्स एन एक्सट्रीमली इंक्लूसिव फिल्म क्योंकि इस फिल्म में प्रॉब्लम पेट्रियार्की है एंड वुमेन कैन बी एज पेट्रियार्कल एज मैन क्योंकि पेट्रियार्की एक सोच है, वो एक जेंडर स्पेसिफिक चीज़ नहीं है.
मुझे लगा था मुझे इस पे बोलना चाहिए पर फ्रैंकली स्पीकिंग वो मैंसप्लेनिंग हो जाएगा. अगर आप इनसे बात करेंगे तो रिप्रेजेंटेशन करेक्ट है और मैंसप्लेनिंग नहीं होगा. एंड वेरी वेल सेड भूमि, जितनी भी फिल्में आपने की हैं बहुत ही प्रोग्रेसिव है, उसमें एक मैसेज होता है और ये फिल्म भी बहुत अच्छी लग रही है. एंड आई थिंक जितने प्रोमोज आ रहे हैं दे आर हिलेरियस. एट द सेम टाइम आई एम अज्यूमिंग कि उसमें एक अच्छा मैसेज होगा.
बिल्कुल, बहुत बड़ा हार्ट है इस फिल्म में और आपने एकदम सही कहा, मैसेज भी बहुत स्ट्रॉन्ग है. लेकिन जैसी फिल्में आपने और मैंने की है आयुष्मान, यू नो हमारी फिल्में भी ऐसी रही कि हंसते खेलते हम लोगों को एक कुछ समझा गए हैं. यू नो बाला बीइंग वन ऑफ द बिगेस्ट एग्जांपल्स और दमनगा के ऑल्सो. तो इस फिल्म का भी वही जॉनरा है, वही मजाक मस्ती है एंड इट हैज अ ह्यूज हार्ट.
एंड कितनी अच्छी तरह यू नो थ्रू रोल्स एज अ मीडियम इतनी अच्छी तरह जो इम्पोर्टेंट मैसेजिंग लोगों तक पहुंचा. आई थिंक दैट इज वेरी वेरी इम्पोर्टेंट. एंड थैंक यू ऑल फॉर डूइंग दैट सो वेल ईच एंड एवरी टाइम.
थैंक यू.
Let me introduce, we also have with us Ravi Bhatnagar, Director External Affairs and Partnerships, SOA Reckitt. And we have Dr. Komal Goswami, Chief of Party, Plan India. So we're going to be talking about a self-care kit, and this is what this campaign talks about. Creating self-care is one of the main things of our program. And Dr. Komal, what I would like to ask you, tell us about this, this creation or, why is this self-care kit important?
Okay. So Ambika, you know that, we have been doing this nutrition program since 2018. And we have realized that we need to start young, not just with the under 5 kids, but with the young mothers also. India is a culture of diversity. It's like we have to reach out to last mile population. And as Bhumi was just saying, talking about agency, lot of our women who are in rural areas or in tribal areas, they do not know the concept of agency. As soon as they are married, they are, as Bhumi was saying, forced upon taking the additional responsibilities, right? They do not have time to take care of themselves, to talk about, mental health. So mental health is something, postpartum depression is something that the logic is very much adaptable and this thing to the urban population, but not for rural or tribal women. So a lot of other things such as hand hygiene, overall hygiene, menstrual hygiene, talking about, ensuring that not just the family is fed well, herself, she and herself is also fed well. It's all about starting very young. When we talk about, that the mother is a high-risk pregnant woman, how does a mother become a high-risk pregnant woman? The mother become a high-risk pregnant woman because she is anemic since ages, maybe when she was just a girl or adolescent, right? And there are no such facility or no such, a person in the family who knows about it and who can guide the mothers. So that's how we devised the self-care kit, which will not just take care of the under 5 kids and prevent them from diarrhea and pneumonia, but also ensure that mother have that agency and mother takes care of herself so that she becomes more enabled to take care of the kid and the family.
Yeah. Absolutely. So let's see what the kit has. Request you to please unveil that. In fact, जो भी ये बता रहे थे, going into the tribal areas, Komal and I traveled about a few months ago to the Siddhi community. Jambur में गए थे, where we met the community. So if you all could please unveil. So let's see what the kit has. And Ravi, if you could also tell us why are these things important. So please.
Yeah. So interestingly, Ambika, this all came from our work, what we have been doing in Amravati and Nandurbar. And I remember our, season 6, where with Mr. Fadnavis, who's Deputy CM of Maharashtra, we made a commitment. And we said, we are going to make sure the tribal kids will be taken care of. After delivering the program successfully with Plan India, we thought, now it's the time to expand the program to various states in India. So now the program is moving from Maharashtra to Gujarat as well as to Rajasthan. And the program aims to reach 10 million moms. The program, aims to reach 1 million under 5 kids. And by the virtue of this program, there are a lot of conversations with the WHO. When they were releasing the self-care report for South of Asia, I was one of the members in the expert committees for the same. the program, the work what we have been doing on the Dettol Banega Swasth India gave us the platform to position and to actually tell like what is working in India, especially in the rural and the last mile. And now this, this kit is being divided into two parts largely. Yeah. One part is for the mothers and the second part is for the kids. So for the mothers, this kit has iron and folic acid tablets, it has vitamin C, it has sanitizers, it has a baby blanket, it has a Dettol liquid soap. For the kids, it's taking care of the diarrhea and pneumonia both. It has the ORS sachets, zinc tablets, thermometers, soaps, amoxicillin tablets, surgical gloves, and the pulse oximeter. Basically, like, we would love to have these kits, placed in the wellness centers, in the ASHA centers, in the Anganwadi centers. Also, we are heavily training now the last mile, delivery for this program, because still in India, the pneumonia cases, diarrhea cases are still very high. And world talks about, 3 countries. One is Bangladesh, second is India. We are neighbors, but the indicators are very different. We really want to move up. We really want to support all the 100+ aspirational districts what India has. And this is our firm commitment, along with Plan India. We're going to take it to the last mile.
So much for explaining that well. And I think, all these things are very easy, doable, like having an iron, folic acid, which every pregnant woman needs to have. But, the importance of having a vitamin C tablet with it for the absorption. So I think creating awareness for the mother and then breaking the intergenerational cycle that only if a mother is healthy, will the child be healthy. So I think that's what it's important.
Like even if you look at urban cities, if my mother is not well, she will completely ignore herself because that is societal conditioning. है ना? उन्हें सिर्फ लगता है कि नहीं, जब तक वो एकदम till they don't reach the tip of it, they will not do anything about it. Most times they feel embarrassed, they feel ashamed, and also ना हमें बताया गया कि हम बहुत strong हैं, हम दर्द ले सकते हैं. Like even if you think of period pain that women have to go through, most times it is just dismissed. And only if you go through it do you understand. आपने और मैंने एक बार इस बारे में बात की थी सर, अगर आपको याद हो. It is just completely dismissed because we are just taught to take the pain. And if you don't take it, you are completely dismissed saying कि बाकी लोग को देखो. But none of us should endure this pain.
In fact, what you were saying, exactly the same thing that we don't prioritize ourselves and just, have to deal with so many things without even talking about it. Embarrassment, absolutely. So now we are joined by Dr. Roderico Ofrin, WHO representative to India. Dr. Roderico, we're talking about self-care. Could you tell us the role of self-care in achieving the right to health?
Yes, thank you very much, Ambika. It's a big question, and it's something probably that was not answered before. WHO's definition of self-care is the ability of individuals, their families, communities to promote their own health, prevent disease, maintain health, maybe to access a health service, and cope with illnesses or disabilities with or without the support of a health worker. It is very much linked to the health literacy of people. Health literacy meaning how you understand health, how you understand symptoms, how willing are you to reach out for health services. It recognizes individuals as active agents in managing their own health care. And in that in itself is the right to health. Once a person embodies that health is their right, then self-care comes in because that person will start looking for information, understanding what they are feeling, when will they actually access a service, but they will start with helping themselves first. It is really a self-motivated way for health promotion, disease prevention, rather than just disease curing. Sometimes self-medication when it is simple. It does not replace the healthcare system. I think that's the caveat that I would like to put out there. It doesn't mean we're saying self-care is important, then everybody just goes and does this themselves. It is that engagement right at the outset, understanding your body, understanding the symptoms you have, understanding basic illnesses and symptoms, and doing something about it. It provides additional choices and options for healthcare and does not at all replace the healthcare system.
Roderico, you see, India is the pharmacy capital of the world. We export vaccines to the world. But the most important question is, are we using those vaccines effectively in India? Especially because the government of India is also focusing on Mission Indradhanush.
Just to tell you very shortly the success, during COVID, we've had a dip in terms of coverage for children, around 15%. That's huge if you have a 26 million birth cohort every year. Now, there was a lot of catch-up being done, really a speed up to catch up where these children are. We have been privileged to be part operationally with that the ministry is in these efforts that the ministry is doing at central and state level. And just to let you know, the recent estimates of WHO and UNICEF this July has shown that India has gone back and even higher pre-pandemic levels of coverage. Are we using the vaccines? Yes, and more. There is also the new policy to introduce HPV vaccines. But more importantly is to leverage the current or just the recently concluded intensified mission Indradhanush to move to measles elimination, but also to create a whole system that through routine immunization, that the routine services will be able to cover all children everywhere, anywhere, anytime, with the vaccines that are required. Because vaccines saves lives. Vaccines is the most economically beneficial public health intervention that we have as of the moment to prevent disease, disability, and deaths.
Friend, thank you very much for joining us. And I'd also like to thank Bhumi Pednekar as well as Dr. Komal for joining us. Thank you so much. एक चीज़ जिसके बारे में हमने इससे पहले भी बात की है अपने शो में, वो है स्वास्थ्य ग्राउंड पर उसका असर क्या हो रहा है, जो इनिशिएटिव्स लिए गए हैं, जो प्रयोग किए जा रहे हैं, ज़मीन पर उसका क्या असर हो रहा है. अब देखिए, एक जो बहुत बड़ी चुनौती है वो है डायरिया, और उसके लिए समाधान ढूंढना बहुत ज़रूरी है. तो डेटॉल का डायरिया नेट ज़ीरो इनिशिएटिव जो है, जो रैकेट ने शुरू किया है, वो अपने आप में एक बहुत ही अनूठी मुहिम है. वो पूरी कोशिश कर रही है कि किस तरीके से उत्तर प्रदेश में 25 ऐसे ज़िले जहाँ पर डायरिया से बच्चों की बहुत ज़्यादा मौत होती हैं, वहाँ पर वो किस तरीके से नेट ज़ीरो पहुँचे. तो उस मुहिम को कैसे आगे ले जाया जा रहा है और उसका परिणाम क्या है. शरद शर्मा अब हमारे सहयोगी जो हैं वो वाराणसी में हैं. शरद, अगर आप कुछ बताना चाहें.
संकेत, मैं वाराणसी में हूँ. वाराणसी देश के प्रधानमंत्री का संसदीय क्षेत्र है और यहाँ पर रैकेट इंडिया ने एक प्रोग्राम चलाया, डायरिया नेट ज़ीरो. ये इसलिए चलाया गया संकेत यहाँ पर क्योंकि ये देखा गया है कि डायरिया यानी दस्त, ये जो छोटे बच्चे होते हैं, 5 साल से छोटे बच्चे होते हैं, उनमें सबसे ज़्यादा मौत या सबसे ज़्यादा कुपोषण जो है वो डायरिया की वजह से होता है. और इसका एक कारण ये है कि साफ सफाई नहीं रखी जाती. तो इसलिए यहाँ पर ये पूरा एक कैंपेन चलाया गया है. मेरे साथ रैकेट इंडिया के डॉक्टर विवेक चौहान हैं. चौहान साहब, कैसे ये शुरू हुआ प्रोग्राम और किस तरह से आप स्वच्छता और स्वस्थता का अभियान चला रहे हैं?
थैंक यू शरद. सबसे पहले तो मैं बहुत धन्यवाद करना चाहूँगा एनडीटीवी टीम का और हमारी रैकेट लीडरशिप का कि ये वाला प्रोग्राम देख रहे हैं. इस भरे मौसम में पानी बरस रहा है यहाँ पर और एक उत्सव का माहौल सा चल गया है यहाँ पर. तो इसकी ये सफलता का एक आईना है जो दिख रहा है. अब मैं आपको बताता हूँ कि हम लोगों ने कई साल पहले, हमारी जो टॉप लीडरशिप थी, उन्होंने ये डिसाइड किया कि क्या आंकड़े हैं डायरिया के. उस हिसाब से हम लोगों ने प्रोजेक्ट होप शुरू किया था. प्रोजेक्ट होप बेसिकली लैगिंग डिस्ट्रिक्ट से बहराइच, श्रावस्ती, वहाँ पर जब ये शुरू किया गया तो हमारी अर्ली लर्निंग्स हुई. अर्ली सक्सेस के बेसिस पर ये देखा कि हमारा जो पिलर्स थे वो थे वुमेन एम्पावरमेंट और इसका प्रमोट और प्रिवेंशन. अब ट्रीटमेंट उसमें से एक पार्ट लगा कि ट्रीटमेंट को और होना चाहिए. हम लोगों ने इम्पैक्ट बॉन्ड लेकर के आए हाइजीन इम्पैक्ट बॉन्ड में हम लोगों ने और साथ में एफडी क्लिनिक्स किए, ORS जिंक पर काफ़ी फोकस किया गया हमारा। फिर फाइनली लास्ट ईयर हम लोगों ने उसकी जो लर्निंग्स निकाल के आई तो ये दिखा कि एक होलिस्टिक अप्रोच की ज़रूरत थी जिसमें हम लोग पब्लिक सेक्टर, प्राइवेट सेक्टर, केयर गिवर्स सबको फोकस कर सकें और एक ऐसी अप्रोच जो सारे के सारे इम्पैक्ट को फुलफिल करती हो, 360 डिग्री पर काम करती हो। तो WHO का 7 पॉइंट प्लान हम लोगों ने अडॉप्ट किया जिसमें 7 पॉइंट में टू जो है वो ट्रीटमेंट के, जिसमें ORS और जिंक और जो 5 है वो ब्रेस्ट फीडिंग, सेफ सैनिटेशन, सेफ वाटर, रोटावायरस वैक्सीन और हैंड वॉशिंग। तो ये एक पूरा का पूरा हम लोगों ने इस पर पूरी ट्रेंड किया। लास्ट ईयर हम लोगों ने 10,000 वॉलंटियर्स को ट्रेंड किया यहाँ पर, 10,000 गुलाबी दीदीज को ट्रेंड किया। 13 जिलों में हमारा काम था और इस साल ये एक्सपेंड करके हम लोग 25 जिलों में आ गए हैं। 20,000 गुलाबी दीदीज पर हमारा काम चल रहा है और ये गुलाबी दीदीज क्या है कि हमारा जो टारगेट है ना शरद, वो है पूरे 10,000 बच्चों को इस साल सेव करना उत्तर प्रदेश में। तो ये टारगेट तभी सेव हो पाएगा जब हम कम्युनिटी इंगेजमेंट करेंगे, रूरल कम्युनिटी के अंदर जा करके हम अपना काम करेंगे, हर घर में हमारी पहुंच होगी और हम अर्ली डिटेक्शन कर पाएंगे बच्चों का। इसके लिए हमारा गवर्नमेंट के साथ प्राइवेट वो MOU हुआ है और सिविल सोसाइटी के साथ MOU हुआ है और हम लोगों ने कुछ टूल्स भी बनाए। और ये टूल्स में जैसे कि आप ये देखिए, ये होगी लाइफ सेविंग किट हम लोगों ने बना रखी डायरिया की। इस डायरिया किट ये हम घर में देते हैं अगर वहाँ अर्ली डिटेक्शन होता है बच्चे का, पूरा फॉलो अप है। इसमें आप देख रहे हैं कि साबुन है, सैनिटाइजर है, थर्मामीटर है और साथ में हम लोगों ने ये जो जिंक की 14 दिन की पूरी खुराक, ORS और साथ में जो IC मटेरियल भी दे रखा है ताकि हम अपने घर वालों को, केयर गिवर को ये समझा पाएं कि ये बड़े ही सरल भाषा में, हिंदी भाषा में हम लोगों ने इसको देते हैं ताकि मैसेज कम्युनिकेट करना बहुत ज्यादा जरूरी है। इसके साथ साथ में हमारे पास में देखिए हर घरों में, लाखों घरों में हम लोग ये पहुंचा चुके हैं कि हाथ धोना कितना जरूरी है और 20 सेकंड तक हाथ धोना, और एक आदमी अगर हाथ धोता है तो उसे कम से कम 10 लोगों तक ये बात साझा करनी है। और जैसे हम लोग नुक्कड़ नाटक, वॉल पेंटिंग, आप ये देखिए कि नजारा, आज इतने सारे लोग खड़े हैं पीछे। हमारे नुक्कड़ नाटक की टीम ऑलरेडी यहाँ पर बारिश में भी तब से सुबह से उत्साहित है और नुक्कड़ नाटक कर रही है। तो ये हम लोग ऐसे टूल्स डेवलप किए और साथ में जो हमारी गुलाबी दीदीज हैं इनको पूरी किट दी गई है, पानी की बोतल, बैग, सब कुछ, ताकि इनको कोई प्रॉब्लम ना हो। अपने घर में जाते हैं और जो अर्ली मॉम्स हैं, जो नई मॉम्स बनी है, केयर गिवर्स हैं, माताएं बहनें, उनको डायरिया के बारे में समझाते हैं, किट प्रोवाइड कराते हैं, सैनिटाइजर, सोप। नुक्कड़ नाटक के दौरान भी हम लोग ये सारी चीजें प्रोवाइड कराते हैं और पूरा का पूरा रिकॉर्ड रखते हैं हम लोग इन सब चीजों का। तो ये अभी 13 जिलों से 25 जिलों में एक्सपेंड हो गया है। नेक्स्ट ईयर हम लोग कोशिश करेंगे पूरे के पूरे यूपी में 75 जिलों में हम लोग इसको एक्सपेंड करेंगे। यूपी के साथ साथ महाराष्ट्र, गुजरात और राजस्थान में भी ये प्रोग्राम जाएगा और डायरिया के साथ साथ निमोनिया को भी हम लोग इस बार कंसिडर कर रहे हैं।
तो कुल मिलाकर स्वच्छता से कैसे स्वस्थता आ सकती है, ये कंसेप्ट उस पर है और बहुत ही बेसिक सी एक बीमारी भी है और बेसिक सी बात भी है कि अगर साफ सफाई नहीं रखते हैं तो पेट खराब हो सकता है और केवल बच्चों का ही नहीं, पेट तो किसी का भी खराब हो सकता है। तो इसीलिए ये जो कैंपेन है ये डिटॉल की तरफ से चलाया जा रहा है।
बहुत बहुत धन्यवाद शरद। We've been talking about the campaign's partners and there have been many who have been integral to our 9-year journey. A journey that has been as meaningful as it has been impactful on the ground. Whether it was raising rupees 281 crores to make toilets in villages in season 1 to the launch of the hygiene curriculum for schools and learning institutes across India. The Reach Each Child program and the cadre it has created of health workers called Gulabi Didis. The first 1,000 days kit, the impact of the Birds and Bees program, the tree plantation drives, the launch of the climate resilient schools, the Diarrhea Net Zero program which we just saw. There is a lot that has been done. To discuss it, we are joined by Dr. Narendra, clinical microbiologist and former Secretary General, Indian Medical Association, Dr. Indira Chakravarthy, public health specialist, Padma Shri Awardee 2014, Ms. Sonali Khan, Managing Director, Sesame Workshop, India, Mr. Sai Damodaran, founder and CEO Gramalaya, is also Padma Shri Awardee 2022, and of course we still have Mr. Ravi Bhatnagar with us. Indraji, my first question is to you. We have been working on this campaign together. You have seen the campaign closely and you've also joined us for our telethons. Tell us, what impact do you see on ground of this campaign and what changes has it brought?
I think this Swasth Banega India has been 9 years over now, going on to the 10th year. I think this was one of the first programs which linked the importance of hygiene to health. I think one of the very first programs was brought into light. At that time, the Swachh Bharat program had started, and Dettol had the Dettol Banega Swasth India program. So this program evolved out of that. So it was the health impact that you wanted to see of these programs. On one side, the Dettol Banega Swasth India, which had started already. I think this was a very innovative approach, one of the first very bold ones to have linked for the first time. Later on, a lot of health-related studies have been going on. But I think this was one of the first when Swachh Bharat started, sanitation movement started, the Dettol Banega Swasth India started. So this was a kind of thing which was a pathfinder. And I think that is a reason, initially we were very skeptical how it will go, because you're linking very different things together. Hygiene on one side, diarrhea on the other side, various health impacts that are coming in, water safety, food safety, hygiene, all linked together. So this was a remarkable journey, to be very often, a remarkable journey. Reckitt was bold enough to start with the whole thing. And today when you look back, you find how wonderful an initiative it was. What a wonderful journey it has been, where we have been taken through this journey. Now I think most of India knows now. You wanted to reach 100 million people, you've reached much more maybe. Now people know very well that these programs, now Jal Jeevan Mission came on after that. So I think it is very, very innovative that this was done 10 years back when you didn't know where it's going to go. And you find that these programs Reckitt took on, and now you know how important these are to health, to public health. As a public health specialist, I feel this was kind of a dream come true for many of us. We've been thinking of that, how to link environment to health, somebody coming up boldly and taking up in a public forum. I think these telethons took it to the public forum. And now across the nation, across all levels of the society, right from the top to the bottom, people know about it. People know that these things that you're doing, see the pictures that you're cleaning. And I think Mr. Gaurav Jain in the morning very clearly said that it putting together in a basket all partners, all kinds of partners from top to bottom. Yes. I mean, I'm not mentioning separately, but everybody was involved, everybody was motivated, everybody took part. And I think these telethons have been a remarkable sort of step forward to have been starting all this, and today reaching where we are. And on this 10th year, I feel very proud, very honored, very happy, very wonderful to have been involved with it. And I think it was a great thing that was done. Ravi has been holding hand right from the beginning. So it was, I would say, a wonderful journey personally for me as well.
Thank you so much for being a part of it. Right.
Yeah, of course. You know what? It's such an enlightening experience for me, being part of this telethon. And I have really noticed in the past 2 years, 3 years, during the COVID, the world was ever evolving, it was changing, and it was bound to change, but the change really hastened and it quickened. And Dr. Saini, my question is for you. That, post-COVID, there's definitely more awareness about hygiene, but there are a lot of challenges which still persist. And how can we collaborate, like this campaign can collaborate with healthcare professionals and doctors, and what will this collaboration will mean to us? How can we take this forward? Uska fayda kya hoga?
Ayushmann, you are very right question. The awareness, there is a two aspect of learning. One is awareness, and Gauravji also touched upon that, behavior change. We have created awareness, but there need to be a behavior change in people, and it takes time. I tell you my experience, I have seen now कि धीरे-धीरे करके लोग भूलते जा रहे हैं. Hand hygiene is a simple thing, but people are forgetting because COVID over, as if every disease is over. Disease कहीं नहीं है, हमारे पास में, हमारे साथ में है, क्योंकि यहाँ इंडिया में तो infectious diseases are most common thing which we have seen. Diabetes, hypertension are there, but common diseases जो है अभी भी infectious disease है. And only prevention is the cure. यदि हम prevent कर लेंगे, like I think you said now, what is the role of other? As a professional, medical professional, my role is to cure because मेरे पास time ही नहीं होता कुछ और बताने के लिए. I can't tell them what is the role of hand hygiene, what is the role of hygiene in food, what is the role of hygiene in water, all these things, and what is the role of sanitation. All these things are together complete the health system. उस health system में medical professional is one part only, that is curative. But people like you, You have seen during COVID, media has done a lot of things. Film industry has done. We are really indebted to all of you because you people are influencer. You change the behavior of people. So everybody is required. We are really thankful to Ricket for coming out with such a program because these are the changes which make the society to think about कि हमें अपने system में लाना है. We have to imbibe all those things so that I don't get a disease. हम क्या है अभी system हमारा क्या है कि हम क्योरिटी पे जाते हैं कि हम बीमार हुए तो इस अच्छे डॉक्टर के पास जाएंगे, इस डॉक्टर के पास से क्योर हो जाएंगे. बट द मोर इम्पॉर्टेंट थिंग इज कि मेरे को बीमारी ही ना हो. एटलीस्ट इन्फेक्शियस डिजीजेज आर ऑल प्रिवेंटेबल डिजीजेज. यदि हम इसको तरफ ध्यान देंगे और जिसमें रोल डॉक्टर्स के अलावा आप जो सारे लोग यहाँ बैठे हैं और जो मेरे सामने बैठे हैं, दे हैव ए इम्पॉर्टेंट रोल टू प्ले इफ वी वांट हेल्दी इंडिया. और ये बहुत अच्छा प्रोग्राम है स्वच्छ भारत. हाइजीन को कई बार ना हम सिर्फ ये ले लेते हैं कि सफाई होगी. हाइजीन इज इंक्लूडिंग कि प्रिवेंटिंग डिजीज. साफ है, कैन दिस प्रिवेंट मी ए डिजीज और नॉट. तो वो भी एक रोल प्ले करता है कि हमें प्रिवेंशन ऑफ द डिजीज विच इज द मीनिंग ऑफ हाइजीन, नॉट मियरली क्लीनिनेस. सो है हमें देखना है. अब हमने जब कोविड में किया, सो बिकॉज ऑफ ऑल ऑफ यू आई थिंक वी आर रियली प्राउड इंडियंस कि हमने छोटे समय में इतनी सारी पॉपुलेशन को कवर कर दिया. बट दिस नीड टू बी कंसिस्टेंट. आप सब लोगों का सबका साथ ये लगा रहना चाहिए. ओनली देन वी कैन से विच अवर प्राइम मिनिस्टर है ऑल्सो ए ड्रीम कि वी शुड बी डिजीज फ्री इंडिया. दैट इज ओनली पॉसिबल.
ये जो बात डॉक्टर सैनी कह रहे हैं, मैं सोनाली जी आपसे पूछना चाहता हूँ क्योंकि ही मेंशन्ड एन इम्पोर्टेंट वर्ड कॉल्ड कम्युनिकेशन. Of course, we can be carriers of that message. But how does that communication become future ready to convince youngsters? And when I mean young, I mean catching them really young. What has your experience been with the Sesame workshop?
This is actually, I think, the most critical question in this whole program because you're talking about the next generation.
Yeah.
So we are all pretty grey-haired and, lived our lives, sometimes
Ayushmann.
learn good habits and then trying to also learn bad habits and then unlearn them.
Yeah.
And I think the unlearning part is the most difficult. So with that, I want to actually come to the real moot point that let's teach them right from go. I think that's the first message to give. I think when the Honorable President spoke in the morning, I think she took up the issue of Mahatma Ji emphasizing educating young children. And I think that sort of set the tonality for this morning, that for the future, we need to really not only understand that children are recipients of communication, and here I want to sort of add another point, they can be change actors. I think that is the most significant point. When we talked about ban on firecrackers, no plastic, who made that change happen? Young kids. Yeah? So when you're talking about hand wash, remember that little kid, if you once embed that good habit, that child will remind adults to wash their hands as well. It's really critical to note that. And as Sesame, we work with little children. Brain development happens the fastest in the first 5 years of a child's life. Hygiene is the most critical. And we forget to teach children hygiene in those years.
Correct.
We just sort of pull the flush for them. The mother washes the hand for the child. We like to do things for our children. What about teaching children to be independent, to do what they can? And it's a very simple thing to wash hands. It's not very difficult. Yeah, to pull the flush is even simpler. So why don't we teach children to do it themselves? They learn and then that'll become a habit for life. So to your point, it's actually not a very complicated communication strategy. It's actually probably the simplest thing.
Yeah.
To teach children a good habit.
Simple things are often the most difficult to do also. To attain simplicity, you've got to work really hard. Of course. To make a mess of things, that is very easy. Thank you very much. Please हमारे साथ बने रहिए क्योंकि इस वक्त हमारे साथ जुड़ गए हैं उत्तर प्रदेश के डिप्टी चीफ मिनिस्टर और मिनिस्टर ऑफ मेडिकल हेल्थ ब्रजेश पाठक जी. ब्रजेश जी, बहुत बहुत स्वागत आपका एनडीटीवी के
धन्यवाद
जी. एनडीटीवी के इस कार्यक्रम में आपका बहुत स्वागत. अभी थोड़ी देर पहले हम वाराणसी की एक रिपोर्ट देख रहे थे जिसमें डायरिया को लेकर के किस तरीके से इनिशिएटिव्स प्राइवेट सेक्टर में भी हो रहे हैं. मैं मानता हूं सरकार भी इसको लेकर के कर रही होगी क्योंकि उत्तर प्रदेश में ये हमेशा से ही एक चुनौती रही है. रेस्पिरेटरी इन्फेक्शन हो, ट्यूबरकुलोसिस हो, इसको लेकर के आपकी सरकार ने क्या मुहिम छेड़ी है, इस दिशा में आप क्या काम कर रहे हैं?
देखिए, जो हमारी चीज है, जो मच्छर जनित लगती हैं या वायरल डिजीज है, चलाते हैं वर्ष में 3 बार। और मुझे इस बात की प्रसन्नता है कि इंसेफ्लाइटिस को उत्तर प्रदेश से पूरी लगभग हमने, आज हमारे पास एक भी डेथ इंसेफ्लाइटिस की नहीं। जानते हैं कि डायग्नोज ही नहीं हो पाई थी बीमारी कौन सी है, संभव हो पाया है। हमें ध्यान हमने चलाए हैं, वर्ष में 3 बार हम चलाते हैं। आज साफ पानी, गंदा पानी हमारे पास जमा हो, पनपते हैं और मच्छर पनपने की वजह पनपती है। जहां तक सवाल है, लगातार स्वच्छता आते हैं और लोगों से आगाह करते हैं बच्चों को स्वच्छ वातावरण प्रदान करें। उनके मुंह में वो जब के बाद चलते हैं, कोई गंदगी का को डायरिया हो, तो पेयजल भी लगातार उपलब्ध कराते रहे। हमारी सरकार कैंप लगाकर के इस दिशा में काम कर रही है। आती है कि हमने जो स्वास्थ्य सेवाएं उनका विस्तार, हमने 5,000 की आबादी पर है, 21,000 के लगभग हमारे पास हेल्थ एंड वेलनेस सेंटर, जो हमारे हेल्थ है सभी सेंटर्स पर हमने CHOs की, वहां पर पैथोलॉजी का भी है। बच्चा के स्वास्थ्य की सारी सुविधाएं वहां पर कराई गई है। जो जुकाम बुखार उनकी दवाइयां वहां पर उपलब्ध रहती हैं।
अगर आप मुझे इजाजत दें ब्रजेश जी, मैं संकेत बोल रहा हूं, अगर आप इजाजत दें, आपके ऑडियो में थोड़ा सा प्रॉब्लम आ रही है, बस 2 मिनट में इसको ठीक करके वापस आप तक आते हैं, क्योंकि जो संदेश आप देना चाह रहे हैं वो बहुत जरूरी है। ये जानना जरूरी है कि उत्तर प्रदेश, most populous state of this country, how is it dealing with its very big health challenges? तो ब्रजेश जी बने रहिएगा हमारे साथ, हम अभी थोड़ी देर में आपके पास वापस आते हैं ये ऑडियो का इशू ठीक करके। आयुष्मान कुछ पूछना चाहते हैं?
Of course, I'll ask my question to Mr. Sai Damodaran. Mr. Damodaran, welcome to the show. And I've closely related to art and music since childhood, and I really believe that children are deeply affected by art and music, and of course it's the way or a tool to bring about that change among the young minds. So what do you think that change is possible through street theatre, and what's your take on it?
In fact, under DBSA program, under school hygiene education program, we are using different tools, art and culture, in educating the children on hygiene messages. For example, the puppet show. Using the puppets, we can instill a habit of hygiene behaviors and messages long-lasting among the children. That way, we are creating a lot of hygiene awareness among the school children. Also, apart from art and culture, we are also using hygiene songs. Hygiene songs are majorly used for different topics like hygiene, personal hygiene behaviors, hand washing, and hygiene during illness, hygiene in neighborhood, all are used for our as a part of our campaign. In addition to that, we are also educating the children as child-to-child approach is our major program in our school hygiene education program. And through child-to-child education, the children are acting as ambassadors of change. They transform the information to other kids, also in their home to their parents, from their parents to the community level. That way, we could able to reach more number of community members with hygiene messages that create more sustainable health and hygiene behaviors among the communities. In addition to that, personally, I wrote 14 hygiene songs, which are on different topics, right from personal hygiene, then kitchen garden in the schools, kitchen garden in the homes, then from morning to evening, what are the hygiene habits. All hygiene songs are specially created, and within a day, I wrote all these 14 songs for the kids. About 20 years ago, which was published by the district collector of Tiruchirappalli city in Tamil Nadu. That way, we are working among the children. Apart from that, the different tools and IEC equipments we are using under DBSA program, like the puzzle game, then the soap making. I would like to tell about more about the soap making. By making the children to involve in soap making, the children learn the habit of how to make a soap and for what purpose the soap is being used during crucial hours of hand washing. That is another important DBSA program is the soap bank. The soap bank inculcates among the children the habit of giving to others in donating on their birthdays to the soap bank. For example, in Tamil Nadu, one of the teachers, after seeing the children's soap bank and donation to the soap bank, the soaps, the teacher gave 82 soaps for all the 82 kids in the classroom.
So that's a very good
that
thing.
kind of
I think it's a great thing that you've
donation
soap
and
bank
giving
kabhi suna nahi hai
culture
pehle.
created among them.
Yeah. So Ravi, my question is to you. You know, 70%, 70% भारत छोटे शहरों में बसता है. अगर हम यहाँ पर पढ़े लिखे लोग, अवेयर लोग बैठकर बातें करें स्टूडियो में, उसको कुछ फायदा नहीं होने वाला. Till the time you go back to the grassroots level and disseminate information about, you know, the hygiene consciousness. तो आप उस लेवल पे क्या कर रहे हैं? Hygiene consciousness कैसे disseminate कर रहे हैं? And what's the future?
Thank you so much, Ayushmann, for asking this question. This has been one of the very longest journey for me, working on a program since last 9 seasons. And we took some baby steps when we started by going to some 4,000 schools and now taking the program to around 9 lakh schools, which means around 30 million school kids. Our leadership invests very heavily to make sure the program leaves no one behind. And today, the program is also going to witness something very interesting. We have 7 borders of India with the 7 countries. You're going to see like how the hygiene program, what we have curated, has reached even to the last village in Arunachal, to the last village which is actually bordering to Pakistan, to last village which is bordering to Myanmar. We have kids coming all the way from Leh, Ladakh, whom you are going to see today. And you will also be seeing a lot of work which is very culturally adaptive in terms of like, you may have heard about the Langas, which is a song genre in Rajasthan. So we have Rais Khan, we did a Rais Khan project with him, and it's on Spotify. And in all the schools across Rajasthan, all the public schools, private schools, that song is played on the very, very regular intervals. It's a part of the Smart Schools program and Atal, school program. In the similar way, in the states like Tamil Nadu and Pondicherry, we launched our song album with NDTV and with Hindu 6-7 months back. It's a part of the Smart School program across Pondicherry and Tamil Nadu. My good friend Saini Damodaran ji, he recently met the governor of Pondicherry. And she said like, this was one of the very big gaps what she identified, like there is no song, no game, no music, and it was just the lecture sessions for the kids, which generally happens in most of the education settings. So we were able to break that, clutter. We introduced our songs, and now songs are there. Then next interesting thing is, yes, using the STEM education. Why STEM education be just limited to India? Why it should not go to Bharat also, where the India resides largely. In the agrarian economy, 70% we are agrarian still. So we put our efforts on the screens regularly, like our kit is being displayed here, which we took as a STEM education kit so that with the help of the Dettol sanitizer and some oil and some cornstarch, some basic 3 ingredients, how you teach kids to make various sizes and shapes of the soap so that the fragrance of Dettol stays. You can make the bunny, you can make the rabbit, you can make the heart, and you can use that soap for the various occasions. Very interestingly, like we got very fantastic response because this has touched something called neuro-linguistic programming, where the kids were involved with the teachers. They were doing it, they were seeing it, they were feeling the fragrance. They were creating, newer kind of shapes and sizes of the soaps. Very interestingly, in the last mile, it started with a few teachers in down south in Telangana 2 years back, where one of the teachers said, we have the milk bank we have the federal banks, we have the wheat banks like the FCI, godowns and other things. Why not to have a soap bank? So we were very curious to understand like what this soap bank is going to do. We tested in down south, we took it to whole of then UP, Bihar, and now in all the states and union territories where Reckitt works in all the schools. We have soap banks in each and every school. On the birthdays, celebrations, the soaps are donated, and then those soaps are actually given to those who belong to the last quintile. And somewhere like, you know, rather than making them, you know, with the unhealthy snacking and other things, it's important to give something which is more useful to the kids. So in this way, we are doing some culturally adaptive messaging, and we are trying to take care of the social norms, and we are ahead of the game as of now.
Is to catch them young. जब आप छोटे होते हैं तब आप बहुत रिसेप्टिव होते हैं, ज़्यादा नई चीज़ें सीखते हैं. And I think it's beautiful. What are you doing? It's great. मैं फिल्मों के जरिए वही करने की कोशिश कर रहा हूँ, by the way.
You know what better way than that? So it stays in their mind as well.
लेकिन अभी हमारे साथ जुड़े हैं ब्रजेश पाठक जी, डेप्यूटी सीएम उत्तर प्रदेश. नमस्कार मिस्टर पाठक, मैं आयुष्मान खुराना हूँ. मैं वैसे पंजाब को बिलोंग करता हूँ, लेकिन अधिकतर मेरी फिल्में जो उत्तर प्रदेश में शूट होती हैं. तो मेरी बीवी मुझे मजाक में बोलती है कि आप दूसरी फैमिली यूपी में बसा लीजिए, क्योंकि आधा टाइम मैं यूपी में ही होता हूँ. तो यूपी को मैं जितनी अच्छी तरह जानता हूँ, शायद अपने होम स्टेट को नहीं जानता हूँ. तो आपसे सवाल पूछना चाहता हूँ कि हेल्थ चैलेंजेस अगले 10 साल में क्या एड्रेस करने वाली है गवर्नमेंट लेवल पर, और कैंपेन्स जैसे हमारे हो रहे हैं, ये क्या फोकस करेंगे अगले 10 सालों में? आई थिंक उनको भी सुन नहीं पा रहे हैं हम. ओके.
आवाज नहीं आ रही लगता मुझे.
जी आ रही है ब्रजेश जी.
आ रही है ब्रजेश जी,
बताइए.
तो पूरे प्रदेश के लोगों को उच्च व्यवस्था मिले, इसके लिए हम लोग प्रतिबद्धता कर रहे हैं. हमारे 105 डिस्ट्रिक्ट लेवल के हॉस्पिटल्स हैं हमारे उत्तर प्रदेश में. डिस्ट्रिक्ट है, लेकिन किसी जनपदों में 2 डिस्ट्रिक्ट लेवल के हॉस्पिटल चिकित्सालय है और 1 चिकित्सालय है. से सभी जनपदों में जो 100 बेडेड अतिरिक्त विशिष्ट हॉस्पिटल्स हैं. हमारे पास 950 के लगभग सामुदायिक जो ब्लॉक लेवल पर होते हैं. इसके अलावा लगभग 3-4 के प्राथमिक स्वास्थ्य केंद्र है, और सबसे बड़ी 25,000 उप केंद्र हैं जो सब सेंटर्स के रूप में हैं. उन सेंटर्स में से हमने 21,000 से अधिक हेल्थ एंड वेलनेस के रूप में जो 5,000 की आबादी है, और सभी अस्पतालों में जांचें निःशुल्क. पैथोलॉजी सेंटर भी चला. जनपदों में मशीन लग चुकी है, जो प्राइमरी मेडिकल केस है उसको हेड इंजरी के रूप में हम दे सकते हैं. इसके अलावा आप जानते हैं कि हमारे बड़ी चुनौती थी प्रेगनेंसी के दौरान पहले अस्पतालों के चक्कर लगा, और अपने देश में समस्या है रेडियोलॉजिस्ट. तो हमने तय हमारी प्रेगनेंसी के दौरान 9 माह में कम से कम 3-4 करना पड़ता था. तो हमने स्टेट बैंक के सहयोग से ऐप बनाया, आशा वर्कर के माध्यम से चिन्हित करके मोबाइल पर हम एक बारकोड, और बारकोड को चिन्हित अस्पतालों में निःशुल्क अपना अल्ट्रासाउंड निश्चित करा सकती है. इसके अलावा जो उनको हमने स्ट्रेंथन किया है, वहां पैथोलॉजी के साथ साथ भी हमने खोला है. जच्चा बच्चा के लगते हैं, छोटी दवाइयां होती है, सर दर्द, सर्दी, जुकाम, बुखार. इसके अलावा सबसे बड़ी बात है कि यदि सब सेंटर पर आ जाता है, सीएचओ के समझ में नहीं आता है, तो संजीवनी किसी भी विशेषज्ञ चिकित्सक से वो तत्काल करा सकते हैं.
ये जो बातें बता रहे हैं, ये बहुत बड़ी बात इसलिए भी है क्योंकि यू आर डीलिंग विद द मोस्ट पॉपुलर स्टेट इन द कंट्री. इतनी बड़ी आबादी को उसके हेल्थ इश्यूज को एड्रेस करना, ये मेरे ख्याल से while the primary responsibility is of the government, At the same time, it requires partnership at various levels for you to be able to achieve anything. Ambika कुछ कहना?
डॉक्टर सैनी, जैसे आप कह रहे थे कई बार आपके पास समय नहीं होता. व्हेन वी टॉक अबाउट हेल्थ फॉर ऑल, लक्ष्य संपूर्ण स्वास्थ्य का, अभी भी क्या क्या चैलेंजेस है? इज इट अ शॉर्टेज ऑफ डॉक्टर्स, नर्सेज की शॉर्टेज है? कई बार हम ओवर मेडिकेशन ले लेते हैं ऑन जस्ट दवाइयाँ खा लीजिए. और इज देयर अ लॉट ऑफ इंफॉर्मेशन अवेलेबल फॉर ऑल ऑफ अस टू सी एंड जस्ट सेल्फ मेडिकेट?
आपने एक पहला क्वेश्चन किया, क्या हमारे पास डॉक्टर्स की कमी है? WHO कहता है कि 1 in 1000 के पास एक डॉक्टर थाउजेंड्स के लिए होना चाहिए. अपरेंटली यदि हम ये देखें तो आज की तारीख में जो स्टैटिस्टिक्स गवर्नमेंट की कहती है कि वी आर 1:850, इट मीन्स एक डॉक्टर 850 पे है. लेकिन इसमें हैरान होने वाली बात यह है, बिल्कुल यू आर ऑल्सो सरप्राइज, आई एम ऑल्सो सरप्राइज, कि स्टैटिस्टिक्स कुछ और कहता है, रियलिटी कुछ और होती है. बिकॉज ये स्टैटिस्टिक्स में डॉक्टर शॉर्टेज है, क्योंकि ये जो स्टैटिस्टिक्स है दिस इज इंक्लूडिंग ऑल डॉक्टर्स. उसमें से काफ़ी लोग माइग्रेट कर गए, काफ़ी लोगों की डेथ हो गई. इसमें कुछ आयुष्मान डॉक्टर्स भी हैं. द WHO का क्राइटेरिया 1:1000. सो 1 शॉर्टेज ऑफ डॉक्टर्स देयर. यू राइटली पॉइंटेड आउट, डॉक्टर्स को एज ए टीम वर्क काम करता है. उसके लिए उसको नर्सिस भी चाहिए, उसको पैरामेडिकल स्टाफ भी चाहिए. और जैसा सिस्टम आ रहा है कि हमारी डिजीजेस आती हैं, देन यू नीड ए हॉस्पिटल ऑल्सो. वहाँ की भी शॉर्टेज है. और तीसरा, अनइवन डिस्ट्रीब्यूशन. You will find doctors are more in the bigger cities, capitals, but not in villages. वहाँ पे अभी भी वो बेचारा जिसको हम झोला छाप डॉक्टर्स बोलते हैं, उनके साथ उनकी वो लेता है. थर्डली, हमारा एक जो बीमारी क्यों बढ़ जाती है, हम सारे के सारे, आपने एक और पॉइंट किया, हम सारे के सारे डॉक्टर्स होते हैं. हम डॉक्टर के पास तब पहुंचते हैं जब हमारे से मुश्किल हो जाता है उसको ठीक करना. अभी कोविड के टाइम भी देखा गया कि एजिथ्रोमाइसिन, टेट्रासाइक्लिन, इन दवाइयों का इतना इस्तेमाल हुआ कि आज की तारीख में वो दवाइयाँ बेकार हो गई. तो आपके थ्रू मैसेज देना चाहूँगा कि आप अपने आप दवाइयाँ नहीं खाइए, कम से कम एंटीबायोटिक नहीं खाइए, और अपने आप को डॉक्टर मत समझिए. जब जरूरत हो तो एक प्रोफेशनल की हेल्प लीजिए. तीसरा जो रोल है प्रिवेंशन. हम बार बार कहते हैं कि प्रिवेंशन इज बेटर देन क्योर, लेकिन अनफॉर्चुनेटली क्या होता है कि हमेशा हम ट्रीटमेंट पे ही रह जाते हैं, क्योंकि डॉक्टर के पास पहुंचते ट्रीटमेंट पे हम ज़्यादा कंसंट्रेट करते हैं. इसलिए ये रोल ऐसे प्रोग्राम्स का बहुत ज़्यादा है जहाँ पे हम प्रिवेंशन की बात करते हैं, क्योंकि हमारे यहाँ शॉर्टेज रहेगी. बहुत टाइम लगेगा अभी हॉस्पिटल्स बनने में, अच्छे हॉस्पिटल बनने में, क्वालिटी हॉस्पिटल्स बनने में, दवाइयों के मिलने में, डॉक्टर्स के और बनने में. लेकिन सबसे अच्छा जो काम हम सब मिलकर कर सकते हैं, इट इज़ ए टीम वर्क. प्रिवेंशन इज ए टीम वर्क. जो मैंने पहले भी कहा, प्रिवेंशन इज रिगार्डिंग माई वाटर, माई फूड, माई पर्सनल हाइजीन और सैनिटेशन. और ये चारों डॉक्टर नहीं कर सकता, सब सोसाइटी को मिलकर. मीडिया हैज ए रोल टू प्ले, एंटरटेनमेंट इंडस्ट्री हैज, बिकॉज दे आर इन्फ्लुएंशियल फॉर पीपल. So media has to play. Ayushmann, you have a role to play. Ravi ji and all these are people are playing. NGOs have role to play. And as doctor, yes, it's my responsibility. I'm doing my responsibility along with all of you.
Exactly, Dr. Saini. In fact, हम तो एक तरह के opinion leaders हैं ही, but grassroots level पर आप लोग हैं opinion leaders. Kids are opinion leaders. I think they're the biggest opinion leaders right now. Coming to kids, ma'am, आपसे मैं पूछना चाहता हूँ कि आप we lead through examples when it comes to kids. Like more than words, actions really reflect that positive change amongst kids. And through Sesame, how are you doing this and how are you scaling it up in future?
You've just said it, positive role modeling. Children learn in the best way if they can see good examples. So as Sesame, this is our sort of core of our messaging. We are a 50-year-old organization, and this is one thing we do, is teach children through positive behavior. We have these amazing Muppets, talking to children. In fact, sometimes I laugh and say that, even as an actor, to appeal to children must be the most difficult thing to do, because, they can reject messages. They can, if you think you're funny, they may just not laugh at you. So as Sesame, we've evolved that how to talk to children. We have these amazing Muppets. They speak to children. They're 5-year-old Muppets, 8-year-old Muppets. And they make STEM easy. They make it accessible. Sometimes today we are using big words, hygiene, sanitation. These are really big words in a child's universe. How can you make these simple things these words very simple, and that's critical. So it's positive role modeling, taking these big words, big concepts, and making them super simple that a 5-year-old child can understand. So those are the principles of communication. With Reckitt, I'd love to say that, we've done some really innovative stuff. How can a child, through 3D modeling, through really, I think the next generation of things, learn how to learn these health messages. Because remember, today that child is digitally native. We are talking about a child who's growing up on AI, they know how to work a smartphone better than all of us sitting here. Yes, there is still the last mile, but through COVID, digital penetration has sort of skyrocketed. It's in villages now. Children learn how to operate a smartphone faster than they learn the alphabet. So as Sesame, I think we live in two worlds. One is the real world of a child, where they are playing with each other, they're going to school. How can we reach there? I think this is one of the biggest programs we are just rolling out with Reckitt in Orissa. The Honorable President inaugurated the health kit. It's going to reach 17 lakh children in the near future, teaching kids about health and hygiene, which everybody here is talking again through these amazing Muppets, really making it special and dear to children, accessible. I think the word is not just having toilets as accessible, but knowledge accessible. I think that is what we are talking here. And the last thing I'd really like to say about positive role modeling, about simplification of messages, is using the digital universe. I think gamification, playing through, through the information. In fact, a recent Bharat EdTech report said that children are spending quite a lot of time on digital. They are watching, in fact, anywhere between half to 2 hours. And I think that is a very significant piece of information. The state of Andhra has 85% digital penetration. So when we talk of scale up, I think we have to use every mechanism at hand. It has to be in the classroom, to the smartphone, and of course through television, which is in every household. So as Sesame, I believe one very simple thing: reach the children where they are. That's the most significant message that I can give today, whether it's through TV, whether it's through your smartphone, whether it's your classroom, and whether it's in the family. You need to empower the entire ecosystem of a child with this unified message. Then we will see change happening in the future.
That's very well said, ma'am. In fact, being an ambassador of UNICEF India, we closely work with young children, and I've worked on cyberbullying also at the same time. We live two different lives altogether. Sometimes it's an alter ego of ours, which is on social media, and we have a different, personality on ground, in reality. And you also spoke about AI. So AI जो है, डॉक्टर्स से मैं पूछना चाहता हूँ कि AI आगे जाकर कितना हेल्प करने वाला है हमारे देश में. I don't know, in terms of health, in terms of hygiene, मुझे लगता है बेसिक लेवल पर एक तरह से हेल्प कर सकता है आर्टिफिशियल इंटेलिजेंस, पर एक पर्सनल टच जो है वो डॉक्टर का है, वो कहाँ से लेकर आओगे?
You are absolutely right. Both things are needed. क्योंकि AI can help you, but the same time जो आप सामने बैठ के करते हो, जैसे there were examples कि आपने सोप बनाया उसको, आपने किया. Unless and until start using, आज की तारीख में knowledge is there, everywhere is there. But उसको use कैसे करना है, that personal touch is also required. उसके question को answer करना है. AI can also give you answer. लेकिन for that, you need to have that society is different. Who will be using AI? वो उनको वैसे ही knowledge है. But we are talking about...
आपके पास patient कोई आएगा तो आपको बोलेगा कि आप smoke कर रहे हैं और वो बोलेगा नहीं कर रहे हैं. AI तो मान जाएगा नहीं कर रहे हैं, पर डॉक्टर को पता है वो सच में smoke कर रहा है.
Absolutely right.
So how will AI gauge that?
That's where I'm saying. Plus वो AI जो है ना, वो एक particular class की use कर सकता है आज की तारीख में इंडिया में. 75% population is staying where they can't even know what is AI. उनके लिए मुझे चाहिए. Plus you are right कि वो AI नहीं पता सकता कि smoke किया कि नहीं किया. If I am seeing that person, मैं उसको देख के बोल दूँगा कि यार the smell of his.
कभी-कभी patient डॉक्टर को देखकर ठीक हो जाता है. बहुत बार ऐसा होता है. AI को देखकर ठीक नहीं हो पाएगा.
Yes.
I think that's a big.
My personal experience, I can say,
Yeah.
70% of the people do not need treatment. When they come to us, they narrate their story. If I'm a good listener to them, they get cured. Because mental satisfaction is very important. That indirectly increases my antibodies also to fight the organism. So a doctor has to be a patient listener, and you are very right. At present, I feel AI has no role in medical system, at least, because that personal interaction is very, very important. Till I have time, narrated my story to my doctor, and who gives me that confidence, that boosts my immunity level also. And that's very important.